How do bronchodilators help asthma patients manage flu? Imagine trying to breathe through a narrow straw while fighting off a cold. That's similar to what happens to someone with asthma when they catch the flu. The flu can cause the airways in the lungs to become inflamed and swollen, making breathing even more difficult. This is where bronchodilators come into play. These medications work by relaxing the muscles around the airways, which helps open them up and allows air to flow more freely into the lungs. For people with asthma, especially during a flu infection, this can make a big difference in how easily they can breathe. People with asthma are considered high risk for flu complications because their airways are already sensitive and prone to inflammation. When the flu virus infects them, it can trigger more swelling and narrowing of the airways, leading to increased coughing, wheezing, shortness of breath, or even asthma attacks. While bronchodilators do not treat the flu virus itself, they are essential in managing the respiratory symptoms that worsen during an illness. By opening up the airways, they help reduce the severity of breathing difficulties and can prevent the situation from becoming more serious. Most commonly, bronchodilators used for asthma are beta-2 agonists. These work by targeting specific receptors in the airway muscles, causing them to relax. This relaxation results in the widening of the airways, making it easier to breathe. Short-acting bronchodilators are used for quick relief during sudden symptoms, which is especially helpful when the flu makes breathing harder. Long-acting bronchodilators are used regularly to control symptoms over time, helping to keep the airways more open even when illness strikes. These medications are usually delivered through inhalers or nebulizers. Inhalers are portable and provide fast relief, while nebulizers are often used in medical settings or at home for more severe symptoms. Using bronchodilators as prescribed by a healthcare professional can help prevent severe asthma attacks during the flu and reduce the need for emergency care. It is important to remember that bronchodilators do not prevent or cure the flu. They are part of a broader treatment plan that includes rest, fluids, fever reducers, and sometimes antiviral medications if prescribed. From the perspective of influenza, bronchodilators do not interact negatively with the virus. They do not influence how the flu spreads or behaves. Instead, they help manage the respiratory symptoms that can be intensified during a flu infection. By controlling these symptoms, bronchodilators can help reduce the overall impact of the illness on high-risk individuals, including those with asthma. This can also help prevent complications that might lead to hospitalization. In summary, bronchodilators are valuable tools for helping asthma patients breathe better during the flu. They work by relaxing airway muscles and opening the airways, which eases breathing difficulties caused by inflammation and narrowing. While they do not treat the flu itself, they are an important part of managing asthma symptoms when illness strikes. Always remember to use these medications under medical supervision and follow your healthcare provider's advice to ensure safe and effective treatment. If symptoms worsen or you have concerns, seek medical guidance promptly.